Hi. Examination of a swelling. One of the most commonest case in a surgery exam. Yet, most of the students lose mark in the case presentation. Remember, most of the cases in surgery fall into two categories, either a swelling or an ulcer. And if you have learned these well, take it from me, you have mastered a major portion of clinical surgery. Today, I will demonstrate an easy, structured and examiner-friendly approach to a swelling in your exams with the help of an Adventitious Bursa which I have excised. Please watch the video and post your questions in the comment box. I will be too pleased to answer them for you. Thank you.
Okay, see this gentleman has been having this swelling over the lateral side of his foot adjacent to the lateral malleolus. This has been there for 4 to 5 months, and he is a temple priest by occupation, and also he needs to sit down. He has to squat on the floor for a long time for doing his pujas and all that. So that is the history, brief history. It's not painful, and it is gradually increasing in size. And on examination, you can find out that it is a well-defined swelling. The margins are well-defined. The surface is smooth. The skin of the swelling is normal. There is no punctum, and there are no signs of inflammation. And when I feel it is a non-tender swelling, and the swelling is freely moving over the underlying structures, and the skin is stretched. Okay, skin is stretched, but however the swelling seems to move under the skin, which means the plane is subcutaneous, and the consistency is soft and cystic. You can see when I press here, these two fingers are moving apart, so it is cystic in consistency. I'm not doing a transillumination test because I feel it will not be transilluminant. So it is a well-defined, cystic, non-tender, slowly growing swelling without any punctum on the lateral side of the foot adjacent to the lateral malleolus. So with all these findings, my diagnosis is a Adventitious Bursa. That is the first diagnosis. And if you are asked for a differential diagnosis in the exams, you can also say that it is a ganglion cyst. It can be a ganglion cyst also. So that's it. Now I'm going to proceed with that excision of the swelling. I'll come to you with the findings later. Thank you. Doing a field block for this. So now what is that? Okay. I am going to raise a subcutaneous wheel all around. What I have taken is 2% xylocaine with adrenaline. So we raise a wheel all around. Okay. You need to have a very cooperative patient for this. Obviously, if it is going to be a child, you will not be able to. For a child, you will require general anesthesia. So here, since my patient is an adult and he is cooperating, I am taking the liberty of giving a field block anesthesia. Right? The advantage is that I'll be able to send the patient home after the procedure as a daycare. Okay, so see, all around I have injected and I'm raising a wheel. This is the cyst. There's a cyst which I have removed, and I opened it. So this is the, see, we have opened the cyst. The contents have removed, and this is the entire capsule. So my diagnosis was right. It is an Adventitious Bursa, and this is the entire cyst. you.